We have said from the beginning that we want to ease restrictions as soon as it's safe to do so, but we're doing it in a very cautious and prudent way. And we are seeing the case counts come down in the hospitals, thank goodness, I think, for all of us. It's 2,059 people in hospital today, whereas last week it was over 2,900. So we are trending in the right direction. We, of course, are working to ensure that this trend continues, but we want to remove the restrictions as soon as we can.
Ontario's Health Minister Christine Elliott says that the government has no plans currently to scrap the vaccine passport system or mandatory mask mandates, even though Saskatchewan and Alberta have both unveiled aggressive timetables for lifting most public health measures. Elliott told reporters today that while the province has begun the process of easing some public health measures, it remains committed to a, quote, very cautious, phased approach to reopening and is not planning to move up its already announced timeline. But as the pandemic drags on, some politicians and business owners are pushing for a speedier reopening. Brampton Mayor Patrick Brown is one of those people. He says he believes there are ongoing repercussions from reopening too slowly. Mayor Brown, thank you so much for joining us. Look, I think what you say resonates with people, of course. I mean, nobody wants to live under these restrictions and closures. But when you talk about, and you spoke about earlier today, reopening sooner, what specifically are you referring to?
Well, there are real consequences to having some of the most onerous COVID restrictions in North America. You know, I look at restaurants that are really struggling. You know, their capacity limits are very severe, 50%. You know, we've lost restaurants in my community. We've lost great restaurants, great small businesses. Repercussions that I speak about are, you know, people losing their life savings for the business that they've invested in. You know, I look at the social isolation in long-term care settings. You know, my own grandmother, who is triple vaxxed, has had her boosters, had COVID. I'm triple vaxxed. I've had my booster, and I can't hold her hand and give her a hug. There's a mental health toll to that. There are so many aspects of these restrictions that, for me, aren't supported by the reality of where we are today. We've seen hospital capacity get better and better week after week. You know, 2 weeks ago at Brampton Civic, we had 110 COVID-19 patients. Last week, 70. This week, 38. As was predicted, we're seeing a steady decline from Omicron, and it's time to get back on our feet as a province and a country. You know, I think there is guidance we can take from around the world that there are ways to live with COVID, to safely reopen in a manner that protects public health and at the same time allows our society to function. And I would note, we're hearing this call more and more from the leading medical officers in the country.
Yes, and look, so the latest easing of restrictions just 2 days ago for long-term care homes. I recognize, you know, still sadly you can't go in and see your grandmother, but she can leave for social day trips. But again, as you know, you can't go in. On that note, the next round of easing of restrictions is coming up on February the 21st. But you mentioned evidence. So on what evidence should Ontario reopen sooner than scheduled? Because, Mayor, right now, February 25th, next round opens up mid-March, the next one after that. Each of these reopenings are separated by 21 days, so the province can monitor public health trends. And Ontario's Science Table has warned just 9 days ago that there will be an increase in the spread of COVID-19 with the relaxing of public health measures. So on what evidence do you suggest that we open sooner than, 2 weeks from now and then again mid-March?
Well, the best data to look at, and I get briefed regularly by public health, is you look at the hospitalization data, which is rapidly declining. You look at the ICU data, which is rapidly declining. You can look at the wastewater, the positivity rate. All the indicators are encouraging. And our own medical officer health in Peel Region spoke to that today, Dr. Lawrence Lowe. You know, everyone is dealing with COVID-19 around the world. And for me, I have continued to challenge why we have to have some of the most onerous provisions in Ontario. You know, we had this debate last month. I was on CP24 advocating for kids to be back into school earlier. I wanted kids to be learning. I worried about the cost for them not being in school and not learning. I worried about the mental health toll. And at the time, there was those in the lockdown crowd who were saying there'd be huge repercussions. The hospitals will be overwhelmed if kids went back to school. And look what's happened. The government made the right call. They brought kids back to school earlier, and there hasn't been those repercussions in the hospital system. We've actually seen the picture get dramatically better. And so there is a way that we can cautiously reopen in this new era where we're trying to live with COVID.
Mayor, is the province being too cautious?
Well, I think it's fair to say we have among the most cautious approach in all of North America.
Mm-hmm.
And so, you even look at personal gatherings right now. You can have 10 people in your home. You can't even have, two, in my family, I couldn't even have my own family gather in terms of my sisters and their kids and my parents. You can't have 25 people in your backyard. When all that hospital data, when all the public health data is clear that, outdoor amenities are safe, that being outdoors is very low risk. And so I think it's fair to say that we're taking an approach that is beyond cautious.
Mm-hmm.
And I think it's important to listen to the healthcare voices, the medical voices who are saying the data now substantiates and supports a faster timeline for reopening.
And so, Mayor Brown, despite what the Health Minister, Christine Elliott, said today, that, we're sticking to, more or less this timeline, it was Sunday that hospitalizations dropped to their lowest levels since early January here in Ontario. Do you think, and we have seen this with the Ford government throughout the pandemic, these about faces, do you think we will see a sooner reopening than, let's say, February the 21st or mid-March for the latest round of the easing of restrictions? Do you think that's something that's going to come based on the pressure and based on some of the metrics?
Well, I hope so, and I have to give them credit. They have pivoted on a number of key issues before when they hear the data, when they hear the feedback from the public. I look back to last spring when they had closed playgrounds and outdoor recreation, and after hearing the data from public health and the public reaction, they reopened those outdoor amenities. I look at the issue of kids in school. They responded to the information from leading medical practitioners and from the public, and they brought kids back to school earlier. So I think there's certainly a trend line here where they've shown the ability to be flexible and pivot. And I hope in terms of some of the ongoing COVID restrictions that we have in Ontario that don't exist in other provinces or states, that they're going to pivot as well.
In terms of mask mandates, vaccine passports, the health minister says, we're sticking to them for now. There's no timeline for when that will end. But what we have here in this province, I can share with our viewers some numbers. So right now for those 12 and up, 85% of Ontarians, that is 12 and up, are fully vaccinated. Sorry, let me start again. 85% of Ontarians 5 and up are fully vaccinated. 90% 12 and up are fully vaccinated. More than 6.5 million of Ontario's 14 million have a booster. Do we really need to have people show a vaccine passport when so much of the province is either fully vaccinated or just under half have a booster at this point?
So, first of all, we have vaccination numbers that would be the envy of many jurisdictions in the world. So, congratulations to Ontario and Canada for exceeding even the most optimistic targets for vaccination numbers. We've done our job. We've sacrificed. We've listened to the public health advice. And I think we're in a relatively strong position because of that. I can tell you in Peel Region, we didn't impose the type of vaccine mandate we've seen elsewhere. I know in some cities, police officers or nurses or firefighters or paramedics have lost their jobs based on their vaccination status. We didn't take that approach. We strongly encourage vaccinations. We strongly encourage everyone to get vaccinated. We arm them with as much information about the safety of vaccines from public health. But we didn't have the type of mandate in Peel Region or in Brampton where anyone would lose their employment based on their vaccination status.
Mayor, you were a former Conservative MP, the former leader of the Conservative Party here in Ontario. You stood by or supported what MP Michael Chong said a few days ago. He said everyone has the basic right to protest, but when that right infringes on the freedoms of others, that's where there is a line. So, of course, pivoting here to the truckers' convoy protest, we saw the former federal Conservative leader, Andrew Scheer, kind of thumbs up with the trucker convoy protesters today. Is that a wise move? I mean, you used to be a member of this federal party, which is already dealing with the search for a new leader.
Well, I think Michael Chong was very articulate in how he expressed that, of course, we have the fundamental right to protest, for peaceful protest in Canada. And, we have a lawn in front of Parliament Hill and in front of Queen's Park, and a space in front of every city hall in Canada where residents have the right to protest. That's a basic right within our democracy. But where I believe a line would be crossed is if you inhibit the freedoms of others, if you inhibit the rights of others. And so, I'd also say that the way we change policy in Canada is through the ballot box. And so any suggestion that you can, through a protest, cause the dissolution of government is not the way our democracy works in Canada.
And when sometimes people, argue with me as a journalist, I say, take it to the ballot box. Those are your elected officials. On that note, your current elected official, of course, clearly, here's the mayor of Brampton. And last week you were asked about the Conservative leadership race. You said your only focus right now is getting Brampton reopened. Once Brampton is reopened, are you ruling out a bid to join this race?
So, in all honesty, I've received a lot of calls from people encouraging me to consider involvement at the federal level, and I do have concerns about the direction of the federal Conservative Party. I do have concerns about the direction of the country. There's no rules to this race. There's no timeline to this race. So I think it would be premature to speculate or even consider a participation in that race. Right now, I'm focused on getting my city reopened to make sure we can do so safely. And, I will monitor the situation in Ottawa with my friends in the Conservative movement. But it would certainly be premature to discuss a leadership race at this point.
But you're thinking about it. You're considering it?
I'm receiving calls and getting advice, but it's still very early on and premature. And right now, I'm very busy in the city of Brampton. And the first person I'd have to speak to would be my wife, Genevieve. But it's very early on.
Okay, not a no, but thank you, Mayor Brown. We appreciate you addressing that again. Thanks for your time tonight. Really discussing what has been on everyone's mind. I mean, no one wants to see continued restrictions, and certainly there's been a huge impact to businesses and the well-being of people, and as you've noted, particularly in your community. Mayor Patrick Brown, thank you so much for your time this evening. We appreciate it.
All the best.
You as well.